Going to be a bit more cash in this one. Collapse bite and discoloration. So this patient initially came to see us because he is unhappy with the color of his teeth and the positioning and how they're wearing down. So let's have a look at the photographs and I'll talk you through it. His appearance is quite discolored. We've got white patches, brown patches, but what's concerning are these areas here. This is tooth wear on his lower front teeth. Now we see this quite a lot. We have to always, as dentists who believe in functional dentistry, figure out why the patient has got tooth wear and come up with a solution so that the tooth wear doesn't continue and worsen. And also, if we're delivering a treatment we want to last a long time, we obviously don't want our tooth wear to affect the new restoration. So the new veneers or the bonding or whatever it might be shouldn't be affected by the reason for the old tooth wear. So if we ignore it, we can end up in trouble with breaking restorations and breaking veneers. So my first thing is to take more photographs and have a look. And if I take this side angle, you can see how inward this patient's teeth are. Now, my patient wanted a brighter smile. Now, the interesting thing about this is he's whitened many times before, but if I show you one reason why teeth that are inward always look darker, then that will help to explain kind of what we did for him to fix it. So if you look at this angle, how his teeth are coming inward, when the light hits these teeth, the light then deflects down. We call them deflective teeth. If the tooth is sticking forward, like let's say this one here, when the light hits it, it's going to bounce back towards you again, and that's called a reflective tooth. Reflective teeth appear brighter than deflective teeth. Now, of course, his teeth are actually discolored, but if I'm trying to make two teeth look more similar in color, then I should try and get the positioning and the angle of the two teeth similar as well. Otherwise, the one that's further forward will look brighter than the one that's further back. And I see this quite a lot. Sometimes when we have veneer replacements and the patient has got existing veneers that they're dissatisfied with in some way, and usually it's not done with a trial smile and a handmade sculpting technique and all of that, but it's the positioning of the veneer that's actually the issue, whereas one is more forward than the other and therefore looks a different color or brighter. So it's a common thing that we're aware of, and so we had to do something about it for my patient here so that we can give him a brighter smile but fix the wear issues that he has on his teeth as well. So what you can see here is the patient has had their lower bite lifted. Now we've focused our porcelain work on the upper arch for aesthetics, and we've used composite resin, which Dr. Karina for me has built up on the lower arch, protecting the wear on his lower teeth, but also lifting the bite and improving color at the same time. There's a closer view. Once I have the patient built up, I'm now able to improve his upper smile using the smile sculpting technique in upper temporaries, and then from the upper temporaries, we'll move to the upper final restorations made out of porcelain. And if I just swipe across, I'll show you the final result. And there you can see the final result. Upper and lower teeth, upper in porcelain, lower with composite. Beautiful effect in the porcelain on the edges so that it mimics nature. What I love the most about this case is how naturally beautiful it looks and how it actually blends in terms of the two materials, but also it's functionally improved the patient's bite and limiting his tooth wear. That means that this will last for a long time and he'll be more comfortable in chewing, and he's not going to get as many dental issues in terms of tooth wear as he would have done without this treatment. It also means that we put his teeth in the right profile. So we can see that from the sides, the profile is now at a 90 degree. So they will all be slightly reflecting the light and they'll all look uniform, bright, naturally white. And what I'm going to include now is a video of me placing the veneers over the surface. And you can see exactly that process and how little we had to touch his upper teeth underneath. These veneers are super thin.